Childbirth is one of the most intense, beautiful, and life-altering experiences a woman can go through. But it's not just about the baby, it's also about you, the mother. Postpartum recovery is often overlooked, and it's critical to understand that this phase of your journey is just as important as labor and delivery itself. Physical recovery after childbirth. The first thing every woman should know about postpartum recovery is that your body has just undergone one of the most physically demanding events in your life. Whether you had a vaginal delivery or a C-section, it's essential to understand that healing is going to take time. Let's start with the most immediate changes. After birth, your uterus contracts to return to its normal size. This process, while essential, can be painful, especially in the first few days. You'll feel cramping, which may intensify when breastfeeding. This is completely normal, but don't hesitate to ask for pain relief if you need it. For women who had a vaginal delivery, one of the first things you'll notice is vaginal soreness and swelling. This could be due to tearing or an episiotomy, both of which can be common. The recovery from vaginal tears or cuts varies, but usually takes a few weeks. Don't forget about the lochia, the postpartum bleeding that can last anywhere from 2 to 6 weeks. It's the body's way of shedding the extra blood and tissue from the uterus. If you had a C-section, your recovery might look different. You will have a surgical incision that needs to be taken care of. This incision needs to be monitored closely for infection. And while you might feel less direct pain in the vaginal area, the incision can cause significant discomfort, especially as you begin to move around more. Rest and sleep. The physical recovery process is taxing, and it's important to allow your body time to heal. However, as a new mom, sleep can feel like a distant memory. Between breastfeeding, diaper changes, and constant care for your newborn, it can be difficult to get quality rest. But your body needs sleep to heal, so don't skip on it. Take naps when you can, and ask for help from family or friends if you need a break. You might also need a pillow or support when sleeping, especially if you've had a C-section. Postpartum hormonal changes. One of the most impactful parts of postpartum recovery is dealing with the drastic hormonal changes that occur after childbirth. These hormonal shifts affect everything from your mood to your physical recovery. Estrogen and progesterone levels drop, which can lead to feelings of exhaustion, irritability, and even sadness. Many women experience what's known as baby blues, which are mood swings and feelings of being overwhelmed during the first few weeks after birth. These emotions can feel intense but are generally temporary. However, for some women, these feelings turn into something more serious: postpartum depression, PPD. PPD is a medical condition that requires attention, so if you feel persistently sad, anxious, or overwhelmed, it's crucial to seek professional support. Breastfeeding challenges and tips. Breastfeeding is often one of the most anticipated parts of motherhood, but it's not always easy. Many women experience latching issues, sore nipples, or difficulty producing enough milk. Breastfeeding can also be mentally and emotionally taxing as you try to navigate what feels like an endless cycle of feedings. But it's important to remember that these challenges are normal. Reach out to a lactation consultant or a support group for help. And remember, it's okay to supplement with formula if that's what's best for you and your baby. There are also the practical aspects of breastfeeding: pumping, storing milk, and ensuring your baby is gaining enough weight. You may not always feel confident in your milk production, but keep in mind that every mother and baby's breastfeeding journey is unique. You're doing great, and finding what works for you and your baby is what matters most. Postpartum exercise and physical activity. As you begin to heal, you might wonder when you can return to your regular physical activity. This is an area where it's important to listen to your body. Early postpartum recovery should focus on rest, but after a few weeks, gentle movement can help. Walking, stretching, and even pelvic floor exercises can be incredibly beneficial for both physical and emotional health. However, it's essential to consult with your doctor before engaging in strenuous exercise. Every woman's body heals differently, and the postpartum period is a time to be kind to yourself. Pushing too hard too soon could result in injury or setbacks. Pelvic floor health. One key part of physical recovery that often gets overlooked is the health of your pelvic floor. Childbirth can weaken the pelvic floor muscles, leading to issues like incontinence or prolapse. Pelvic floor exercises, such as Kegel exercises, are great for strengthening these muscles and supporting your recovery. Your doctor or a physical therapist specializing in postpartum care can help guide you through these exercises. Nutrition for postpartum recovery. What you eat during your postpartum recovery can make a big difference. Your body needs extra nutrients to heal and to support breastfeeding. Focus on eating nutrient-dense foods like fruits, vegetables, lean proteins, and whole grains. Stay hydrated, especially if you're breastfeeding, and avoid excessive caffeine or sugar, as they can affect your energy levels. Also, don't forget to take your prenatal vitamins for a few months after birth, especially if you're breastfeeding, to ensure you're getting the right nutrients. Support systems and asking for help. No one expects you to do it all on your own. Having a support system is crucial for your physical and mental health. Whether it's your partner, friends, family, or a professional, don't hesitate to ask for help. Having someone cook meals for you, do a load of laundry, or take over baby duty for a few hours can make a world of difference in your recovery. And let's not forget that self-care is vital. Take time for yourself, even if it's just a few minutes a day. A hot shower, a walk around the block, or sitting down with a book can work wonders for your mental health. Postpartum recovery is a journey. It's full of highs, lows, joy, frustration, and everything in between. But know this, you are not alone. Take your time, trust your body, and reach out for help when you need it. As you heal physically, remember to give yourself grace emotionally. Every step you take in your recovery is a victory, and you deserve all the support and care along the way.